Hi everyone, my name is Cathal Keane and today I'll be presenting a paper titled An Investigation of Muscle Activation During Swallowing using a low-cost sEMG device. This project was completed as part of my master's thesis during my master's in medical physics, which concluded in September 2021. Dysphagia is the term used to describe difficulties when swallowing. It affects the throat and symptoms can be very painful and for some people even severe. It can commonly lead to aspiration pneumonia, a type of lung infection that is due to a relatively large amount of material from the stomach or mouth entering the lungs and causing a bacterial infection. There are two types of dysphagia, oropharyngeal and esophageal. Oropharyngeal dysphagia usually occurs due to a weakening of the throat muscles, whereas esophageal dysphagia usually occurs due to food becoming stuck in the throat when swallowing. In both, blockages in the esophagus and trachea are common. Dysphagia affects several core groups. Most notably, it affects, but is not limited to, patients suffering from acute stroke, throat cancer, dementia, and Parkinson's disease, as well as children suffering from cerebral palsy and children with Down syndrome. Dysphagia can cause several conditions and overall discomfort. Psychological problems can occur where people may feel embarrassed or, in the case of older people, may need a full-time carer to help them eat and hence not like the lack of independence surrounding something most other people would take for granted. Throat-related problems can occur where people with pain when eating may not eat or eat in smaller portions, leading to malnourishment and weight loss. Gastric problems can occur where stress and anxiety induced by some of the above problems, although rare, can induce peptic ulcer disease and the formation of a gastric ulcer, as can a change to a stricter diet. Some solutions are PEG feeding via a feeding tube that is endoscopically guided through a small opening in the upper abdomen, or being placed nil of mouth by a physician or speech and language therapist. This is where the patient is not allowed to have any form of food, drink, or medications by mouth. These, however, can result in additional medical complications. Dysphagia can be managed and treated in several ways, both invasively and non-invasively. Invasive procedures include feeding tubes, Botox, surgery, endoscopic dilation, or stents. Non-invasive procedures include a change in their diet, medication, or swallow therapy. We elected to focus on non-invasive biofeedback manoeuvres in this project. All swallow therapy manoeuvres train the patient in a certain way to help make them more efficient at swallowing. Some manoeuvres are more effective than others, however. The Mendelsohn manoeuvre from the literature appears to be the manoeuvre that can return the greatest range of swallowing back to the patient. When conducting the Mendelsohn, the patient holds their hyoid bone up high, which correlates to a reduced risk of choking and greater overall swallowing ability. Over time, it is hoped the patient will then do it naturally by clenching their muscles. Biofeedback games are also used to implement these therapies. In the study shown on the right, two groups of 10 people each were tested. The experimental group used the Mendelsohn manoeuvre and a biofeedback game to increase hyoid bone displacement, while the control group was treated using traditional swallowing training and laryngeal elevation exercises. The experimental group, although had lower hyoid bone displacement initially, they surpassed the control group after the study had concluded. All participants had post-stroke dysphagia. An Arduino UNO WiFi Rev2 board and MyoWare surface electromyography sensor were used to collect the data used, and are shown on the right. The Arduino and MyoWare EMG sensor were chosen due to their ease of use, availability, and price point. The MyoWare sensor measures the filtered and rectified electrical activity of a muscle at rest and during activation. It can output the amount of activity it detects up to the voltage of the power source, in this case 5 volts. The Arduino acts as an analog to digital converter, collecting the data and sending it to the serial plotter in the Arduino environment. The data was exported to Microsoft Excel and then analyzed. Two experiments were conducted. In the first, 10 milliliters and 20 milliliters of water were swallowed to test the sensor and compare its response. In the second, 20 milliliters of water were swallowed using the Mendelsohn and Effortful Swallow manoeuvres. The data collected from the sensor was graphed in Excel and in real time in the Arduino environment using its serial plotter. Corrupted or unusable data points accounted for less than 1% of all data points collected. The two graphs show a particular Effortful Swallow and Mendelsohn manoeuvre. The data was filtered and smoothed to highlight the shape of the graphs. As can be seen with the Effortful Swallow manoeuvre, the baseline remains stable until the swallowing event, as there is no holding of the hyoid bone and hence no early spike in voltage. Then in the Mendelsohn manoeuvre, after the initial baseline, the baseline spikes to the manoeuvre baseline as the hyoid bone is held. The swallow can be seen as the first peak, and the secondary peak is created by the hyoid bone returning to its rest position. The purple arrow shows the resting baseline voltage of the throat muscles. The orange arrow in the Mendelsohn graph shows where the manoeuvre begins and where the hyoid bone was held for approximately 2 to 3 seconds. The red arrow shows the peak voltage produced by the muscles when swallowing the water, and the blue arrow shows the peak of the voltage produced as the larynx and throat muscles return to their resting position. In both experiments, a two-sample t-test was conducted at the 95% confidence interval. There was no statistical significance recorded for experiment 1 using the normal 10 milliliter and 20 milliliter swallows, concluding that increasing the volume swallowed seemed to have no significant effect on muscle activation. For experiment 2, testing both manoeuvres, a 2-sample t-test was also conducted, and it was deemed statistical significance between both sets was significant at the 95% confidence interval, thus meaning the Mendelsohn manoeuvre appears to affect the voltage response from the muscle when compared to the Effortful Swallow manoeuvre. However, due to the time constraints, only 5 tests of each manoeuvre were conducted. In the future, we hope to refine the system further, including the placement of the sensor to increase reproducibility of results and eliminate errors. We hope to develop a mobile app and game in the future that could work in conjunction with different techniques to provide therapy to the patient. We also hope the mobile app will track a patient's ability over time to show their improvement, allowing the data to be interpreted in the application and the game controlled by the muscles. We also hope to incorporate a machine learning algorithm. The app can then be used by a physician and further regimes can be allocated based on the patient's improvement or degeneration. Thank you all for your attention today.